Common mistake: losing the foot tripod in the squat. A stable squat relies on the foot tripod, heel, big toe, and little toe, maintaining even pressure. When the heel lifts, the tripod collapses, shifting weight forward and reducing stability. This often results from poor ankle mobility or improper weight distribution. To correct this, anchor your foot by keeping steady contact with all 3 points. Engage your arch by pressing the toes down and back without shifting weight off the heel, and improve ankle mobility to allow deeper squats while keeping the foot tripod intact. Common mistake: excessive rounding of the back in the squat. A strong squat requires maintaining a neutral spine throughout the movement. Rounding the back often stems from poor awareness, lack of erector spinny engagement, or inadequate core bracing. To correct this, focus on maintaining a neutral spine by engaging the erector spinny, keeping the chest lifted, and bracing the core. Use cues like proud chest and brace your core to reinforce proper positioning. Common mistake: excessive and uncontrolled knee valgus. Excessive inward knee collapse during a squat can reduce stability by lifting the lateral side of the ankle and disrupting force transfer. This diagonal force misdirects energy, potentially decreasing power output and squat effectiveness. However, controlled knee valgus can be beneficial. It reduces the demand on the adductor magnus while engaging the glutes and lateral hip rotators. A slight inward knee movement may be a natural adaptation for lifters with strong glutes and weaker adductors. Should it be corrected? Yes, if it is uncontrolled, causes discomfort, or indicates a muscle imbalance. Not necessarily if it is controlled, supports heavier lifts, and does not lead to pain or instability. Common mistake: excessive forward lean due to feet pointing straight ahead. Pointing the toes straight forward can restrict hip external rotation, limiting the hip's ability to move freely into flexion during the squat. Since the center of mass must stay within the base of support, reduced hip mobility alters weight distribution. When the hips can't rotate naturally, the body compensates by leaning excessively forward to maintain balance and reach depth. To correct this, slightly turn the feet outward to improve hip mobility and allow for a more natural squat pattern. This adjustment enables the hips to move freely into flexion, reducing the need for excessive forward lean. Common mistake: excessive anterior pelvic tilt in squats. Overarching the lower back and tilting the pelvis forward disrupts force transfer, reducing squat efficiency. This often happens when trying to push the hips back too far. To correct this, maintain a neutral pelvis by engaging the core. This will allow for better force distribution and a more effective squat. Difficulty: excessive forward lean due to femur length. Individuals with longer femurs relative to their tibia and torso often struggle to keep their torso upright, leading to excessive forward lean to maintain balance. To correct this, widening the stance helps reposition the thighs, allowing for a more upright torso. Elevating the heels, whether with weightlifting shoes or small plates, compensates for limited tibia length by shifting the center of mass forward, making it easier to squat with a vertical torso. Front squats naturally encourage a more upright posture by moving the load forward. Lastly, improving ankle dorsiflexion increases knee travel over the toes, reducing the need for excessive forward lean. Common mistake: pointing the toes too far outward. Excessive toe out positioning can reduce stability, disrupt knee tracking, and limit force production, placing unnecessary strain on the hips and knees. To correct this, position your feet hip width apart with your toes pointing outward at a slight angle, typically between 10 to 30 degrees. This ensures better control, proper knee alignment, and a stronger, more efficient squat.